Shall we start, doctor?
Yeah. It's okay.
Just I'll put the time.
Mm-hmm.
Your time starts now. Time is up.
Yeah. Hello, I'm Dr. Shanti. I'm Shanti, one of the ST5, and you?
I'm John, doctor.
Okay. John, how are you doing?
Yeah, I'm fine, Shanti. Actually, yesterday in the clinic, our consultant was doing examination of patient who had, prolapse of the uterus, and he was taking some measurement. I was just keen to know about, what were these measurements and why these measurements are required. So, can you tell me more about it?
Yeah. Sure, John. So, everything is fine in the department? Everybody is helpful?
Yeah,
Yeah.
actually, I'm doing quite well and getting oriented basically to the department.
Mm-hmm. Okay, so John, sure, I will explain to you today regarding this POPQ. And this is a new system of pelvic organ prolapse quantification. It is standardized by the International Pelvic Organ System team. And so the importance of this is that we are able to diagnose and classify the pelvic organ, the staging, and also it reduces the interpersonal variation, and it is a standard in case of any scientific presentation. So this is the importance of this pelvic organ perfusion system. So first of all, a patient is that the most important thing is that so patient should empty the bladder and empty the bowel as well, so that it will not interfere in the this classification system. This can be done in the position should be, it can be lithotomy position, it can be left lateral position, or it can be also a standing position, and it should be confirmed by the transperineal ultrasound. Okay. Can you tell me what is the importance of this? What is the helpful for this POPQ system?
Uh,
One of that.
yeah, basically, it reduces the interpersonal variation.
Yeah. So yeah, you are a very good learner, John. First of all, yeah. So after that, once the patient is we have to make it in the grid system. So we have to see the anterior vaginal wall, and also posterior vaginal wall, and also apical. So in that we have got here I am drawing the grid. So we have got total 9 grid. So in the anterior vaginal wall we have got 3 points. Okay, so we have got AA, and also we have got BA, and we have got C. That is AA means I will be telling while examining, and again we have got the posteriorly, we have got AP and BP, and also D is there. And in the center, apical, we have got the hiatus, genital hiatus, we have got the perineal body, and also we have got total vaginal length. Yes. First of all, when we are examining, so if patient is on lithotomy position, it has to be more, examined by the valsalval maneuver. First we have to put the speculum. So in order to see the anterior prolapse, either we have to see the whether cystocele, or whether it is the uterine prolapse. So we have to put the same speculum posteriorly, depress, and then hold the hold the cervix downwards traction, and then not hold, just to tell the patient to give the valsalval maneuver so that maximum prolapse can be seen. AA will be the fixed point is from the hymen. So hymen will be usually the 0, and if it is proximal to the hymen, it will be all minus point, and if it is distal, it will be the plus point. If AA, it is like from the hymen, 3 centimeter proximal, that is -3, and BA will be the 3 centimeter the distal, that will be the +3. C is the cervix. And similarly, once you have done, then you have to see any uterine prolapse is there or not. Then after that, we have to change the speculum to the anterior. So we have to leave the anteriorly, then see the posterior. Posteriorly, again, similarly, we have to see the AP is again from the hymen 3 centimeter behind. That is the normal position. And any how much is the distance, we have to see the plus point. And again, BP also is same thing. As I said, it is a maximum the descent, and D will be the posterior fornix. So all these points. Then after that, we will remove the speculum, and we have to reduce the prolapse, and then we have to do the total vaginal length. And genital height is measurement. Height is the mostly to the urethra, to the hymen, and this perineal body from the posterior part of the hiatus to the hymen to the anal canal, anus. So this will be the perineal body, and total vaginal length from the hymen to the posterior fornix. So this will be total vaginal length. So all this point is done Valsalvan maneuver except the total vaginal length. Okay, so which is done without Valsalvan maneuver, John?
Total vaginal length, Dr. Shanti?
Yes, yes, yes. And in case of if a patient is had hysterectomy, so there will not be any D point. Okay. So which point will not be there in hysterectomy patient?
D point will not be there, doctor.
Yeah, so D point will not be there. So this is what we classify. And in case of if any yeah, so now it will be stage one, stage two, and stage three, stage four staging. So stage one will be stage zero will be there is nothing. All will be in proper position. All will be minus point. And so stage one will be it will be like more than minus 1 centimeter above the hymen, and stage 2 will be the at the level of the hymen, that is the 0, and 3 will be more than 1 centimeter from the hymen, and stage 4 will be total presidency. Are you with me?
Yes, yes.
Yes. Any questions so far?
No, doctor.
And
Basically, we will examine and then we will stage and either 0, 1, 2, 3, or 4. Yes, yeah.
And most important thing is that again the confirmation of the staging should be done by the ultrasound, that is the transperineal ultrasound is very important. So we have to confirm the staging, and also the once we have done the lithotomy position, we have to ask the patient to stand up, and then again do the Valsalvan maneuver and to see the prolapse, so it will confirm the diagnosis. Actually, the apical prolapse and the anterior prolapse, as usually it will change, it will become more when standing position, except the posterior prolapse. Okay, so which prolapse will be, there will not be change on?
Posterior one?
Yes, yes. So you are doing very well, John. So any questions so far?
No, no. It's quite
Yeah,
good getting
yeah.
it.
So how was the session, John?
Yes, doctor. But so many points and measurements. I think I need to practice. That's the thing. I have
So
understood
I
that there are points
yeah.
and some measurements we need to do, and the practice will make me more perfect. That is what I feel, doctor.
So surely next one session will be there. I will be there to help you to the put in the group form, and I will also give you some reading materials. And anytime you have any questions, you always I will be happy to help you. So thank you so much. Have a lively day.
Thank you, doctor. Thank you. You still have 1 minute and 20
Huh?
seconds. This 1 minute and
Ah,
20 seconds.
okay.
Yeah, yeah. This,
So
yeah, but you
what
have covered
else?
all the points. You have covered all the points here.
What else?
There are certain some
I think
situations.
something. I think I did not. Anything I missed.
Site specific repair. Okay, when you
Hmm.
started with first thing, it is also recommended by many international societies for the prolapse. It maintains the inter observer or it avoids the inter observer variation rather than interpersonal, say inter observer variation.
Right.
Second thing
Yeah.
is that it will be uniform assessment
Hmm.
because we are quantifying in form of measurements.
Hmm.
And third thing is it helps to identify the defect, where exactly the
Yeah. Yeah.
defect
Hmm.
is, which can be corrected. So site specific repair is possible. Okay.
Hmm.
Not only
Yeah.
that, we have to assess pre-operatively and post-operatively. Okay.
Yeah. That was.
Okay, so that point is going to be very, very important. So this introductory part only you finish first. Okay,
Mm,
then you go for the grid.
yes.
Describe all points, and third will be the stages.
Yes.
Okay. So these are the three different points. One is general about the pop cube. Okay.
Mm-hmm.
Then you describe all points, measurements which
Mm,
we are going to take, and third will be the stages.
okay.
Okay.
Mm,
So that is what we are going to discuss. Then about AA, BA, then point C, then AP, BP, point D, and three we have measurements. Okay, there are 6 points. Always there are certain things. There are 6 points. There are three measurements. It's a 9-cell grid. Okay, out of
yes.
which, and these particular things you ask. Okay, how many measurements will take? Six
Yeah.
measurements.
Okay.
6 points. How many and how many measurements? Three measurements and 6 points we are going to chart. Okay, along with the
Mm,
measurements. That is what you say. The reference point, again, ask the reference point. Very simple questions you should ask. Okay, so
mm,
reference point is hymen,
um,
and the
mm,
measurements above the level of the hymen will be minus. Measurements
This
beyond
is
the
a
level of the
reminder.
mm,
Recharge.
hymen will be
This is a
given positive.
reminder.
Just
mm,
Recharge.
okay. So we have that particular thing about the measurements. Then how to differentiate apical, anterior, and posterior prolapse. The point AA and point BA will tell about the anterior prolapse. Point AP and BP will tell about the posterior compartment, while
mm,
point C, D, and TVL will tell us about the apical prolapse. So whenever we check the grid, always see AA, BA together, AP,
mm,
BP together, okay, and the vertical row of three, okay,
yes.
C, TVL, and the D,
Mm,
all
mm,
these points. Okay,
okay.
so
Yes. Mm,
sometimes this task also they can modify by giving
yeah.
some figures. Okay,
Mm,
so if you have
mm,
this particular way of approach towards this particular task, it will help you. Okay,
yeah.
look at AABA, it will tell us about the anterior prolapse. Look at APBP, it will tell us about the
Yes.
posterior
Posterior.
compartment. Then
Mm,
go the last line vertically. C, D, TVL and D, C, TVL and D. It will tell us about the apical prolapse. Then
yes.
about the genital hiatus. Okay.
Yes.
This, or better to say, about the perineum. What we are going to get idea from these measurements, that is GHPB. Okay. So that will tell us about the perineum. Okay. So these are the points which we are going to describe. Okay. Then come to the stages.
Yeah.
That's all. Stage you have described.
Mm,
Only thing is that stage 3 and stage 4. Just be careful. You mentioned stage 4 while you mentioned about the procedentia. Okay, it corresponds to the procedentia.
mm.
But how will you describe in centimeters? Okay,
Yeah. Total vaginal length minus 2. More than. Yeah.
M- uh, more than TVL minus 2, no?
Yeah. Yeah. More than TVL minus 2. Yes.
Okay, so that will be stage 4. Okay, so that is how means overall this task you have performed well, and even the interaction with the role player was good. So I'll say that this was also a pass station. Okay, only a couple of points, because it varies from
Yeah.
person to person. Like
Mm,
what I said, what you are going to teach, it varies from person to person. Okay, but include those couple of points which I mentioned in the beginning. Okay, divide the
yeah.
task into three.
Mm,
The first will be about the grid,
mm,
the 6 points, three
mm.
measurements. Describe
Okay.
all the measurements. How will you take?
Mm,
Third, go for the stages. Okay,
yes.
okay. So that finishes the third task also. Let me see. I have, I think I don't have this same thing I have kept. So rational is a standardized and reproducible prolapse assessment. Reference point is a hymen. 6 points are there: A, B, A, C, D, A, P, and BP. GH, PB, and TVL, these are the measurements. Okay. So always say these together, these
Hmm.
together. So
Okay.
here is an anterior compartment, here is a posterior compartment, and here is a apical compartment. Okay.
Okay.
And this will tell us overall about the perineum. Okay. Genital hiatus will
Okay.
be enlarged and the perineal body, this will be reduced once there is a
Okay.
prolapse. So these points are going to be important. This all we are going to check post-operatively also. Okay. So
Hmm.
when you have this particular thing in front of you, know,
Hmm.
your visual memory and description should go
Yeah.
together. Okay.
Hmm.
So values recorded in centimeters above and below hymen. Uh,
Hmm.
Examples help in understanding links to patient care, surgical planning, audit, communication, etc. Because uniformity is there. Okay. Then good
Hmm.
teaching uses diagram, checks understanding. Okay. Here the
Yeah.
same thing, plus and minus is described. Sorry,
Yes.
stages are described. Okay. Here is a reference point. Okay.
Hmm.
Same anterior wall, anterior posterior wall, posterior wall. This is C is cervix, D is
Yes.
okay. So that finishes the POPQ also. Okay.